Hello, my name is Tatiana Ogurtsova, and welcome to our poster entitled Fathers Matter. Fathers of children with disabilities are parents with much greater challenges and concerns. They are experiencing heightened levels of stress, psychological distress, their own physical health problems, financial difficulties, and social isolation. They're now more frequently involved in child care beyond traditional roles, and their involvement results in better child developmental outcomes, mother's emotional well-being, marital satisfaction, and overall family functioning. They're really critical partners in family-centered care. Nonetheless, they do report feeling excluded and marginalized by healthcare professionals. Our objective was to explore the barriers and facilitators to positive and empowering interactions and parent-professional relationships from the perspective of fathers of children with developmental disabilities and healthcare professionals working in childhood disability. We used a mixed method approach, and we administered surveys and semi-structured interviews to fathers of children with disabilities and healthcare professionals working in the field of pediatrics. We recruited from 2 sites in Montreal and Vancouver, and we use a thematic analysis approach of emerging ideas using the in vivo software. 7 fathers were recruited. They were aged about 42.6 years old. All of them were Caucasian, biological parents to their children, working full-time. Some were married and others were single. Their educational level ranged from a college to a master's degree, and their children were about 9 years old with different conditions such as epilepsy, anxiety, cerebral palsy, and autism spectrum disorder. We recruited 13 healthcare professionals, aged about 37.8 years old, predominantly female, coming from different disciplines, predominantly working full-time, with a fair amount of experience in childhood disability, and practicing in different areas such as neurodevelopment, intellectual disability, complex care, orthopedics, and neurotrauma. Our dads reported that they're moderately to very much satisfied with their interactions with professionals, and they feel generally comfortable and understood and supported by them. Nonetheless, they do report that healthcare providers are only sometimes attentive to them, and that those interactions are actually very impactful and significant for them because it improves their awareness and knowledge about the child. It encourages them to continue to be involved. It has a positive influence on the child's development and progress. It reinforces and reassures them that what they're doing is valuable and makes them feel included and considered as a parent. In terms of barriers and facilitators that have emerged, some factors were related to dads, and those include dads who are engaged versus disengaged, their acceptance versus denial of the child's condition, strength, and challenges, helpful versus unhelpful personality traits, knowledge versus ignorance, a supportive versus a hindering work condition and stress. Other facilitators included the ability to share feelings, their openness to learn, and barriers included negative past experiences and a difficulty understanding healthcare professionals. Other barriers and facilitators were related to healthcare professionals and included being supportive versus focusing too much on the negative, actively listening and paying attention to that versus ignoring them, considering cultural differences and knowing how to bridge them, having a high versus a low confidence level, giving time, not rushing interactions, and providing explanation using lay terms. Other barriers and facilitators have emerged and included cultural beliefs about fathers' engagement, female healthcare professionals, and different health disciplines, for example, physician versus a therapist, healthcare system challenges such as waiting times, as well as time limitation during interactions when those are being rushed. Facilitators included communication strategies that work, long-lasting parent-professional relationships, following up with fathers when they're absent, and accommodating their schedules. Several solutions have been mentioned by both study groups, and those included being conscious of behaviors, belief, pre-existing stereotypes, and cultural differences, For healthcare professionals to increase their eye contact and attention to fathers in conversation, to involve them more in decision-making, treatment plans, assessments, and crucial time points, to find ways to promote clear communication that is suitable and relevant, consider parents as a team, inquire on both parental agendas, remember child's strength, following up with fathers if they're absent, and consider how fathers are portrayed in their clinical setting. Our next steps are to work on developing a knowledge translation video for healthcare professionals, and we're offering a sneak peek of this video later during this particular presentation. Thank you very much, and we're leaving you with some of the most salient quotes from our participants.
Meet Jean-Pierre Callisto. Jean-Pierre has a son, Michael, who is now 13 years old. Jean-Pierre, being Michael's primary caregiver, is an involved and an engaged father. Following an uneventful pregnancy and birth, Michael appeared to be typically developing. However, at the age of 4 months, he started having continuous seizures. Shortly after, he was diagnosed with a heart and brain defect. Michael has cortical dysplasia, where brain areas lack the appropriate neural connections to function properly, and epilepsy. At 4 months of age, Michael underwent heart surgery. At 8 months, he underwent a right frontal lobotomy. At 11 years old, he had a bilateral hip osteotomy. To this day, Michael still has seizures every night during sleep. Currently, at age 13, Michael is developmentally like a 1-year-old. He is fully dependent on someone for all of his self-care activities, including eating, bathing, and dressing. Michael is able to walk, but with a lot of difficulty and using special equipment. Michael is a boy who smiles a lot and gets excited when he sees something he likes or someone he loves. Michael enjoys many important things in his life, including going for walks in a park, music, and good food. Since birth, through Michael's journey within the healthcare system, he has had more than 100 interactions with healthcare service providers. Michael and Jean-Pierre have seen health professionals from at least 15 different disciplines, including anesthesiologists, audiologists, cardiologists, nephrologists, neurologists, neurosurgeons, ophthalmologists, physiotherapists, occupational therapists, respiratory therapists, orthopedic surgeons, special educators, and speech-language pathologists. Jean-Pierre is here today to talk about his experiences in the healthcare context as the father of a child with disabilities, what goes well, where there are challenges, and what can be improved.